Hello everyone, I am Sandra May Ibraniolo from BSN 212E of Davao Doctors College. And today I am going to perform perineal flushing. So perineal flushing is a hygienic care that involves cleaning the perineum and the genitalia. Washing this area properly means it is very important in order to prevent odors, infections, and irritations. So prior to the conduct of the procedure, I have prepared the necessary equipments needed in order to save time and energy. So the equipments that I have prepared is the alternative bedpan, a pitcher with warm water, alcohol, betadine, a 7 cotton balls soaked in a cleansing solution, another 7 cotton balls, 2 kidney basins, 2 forceps, clean gloves, perineal pad, and the draw sheet. Also, do not forget to perform hand hygiene before doing this procedure so that we can prevent cross-contamination as well as protecting the patient and myself. Good evening, ma'am. I am Sandra May Ibraniolo, your resident nurse for today. Kindly please state your complete name,
Mrs. Dayan G. Ero,
your birth date, and civil status, please.
January 6, 2004, single.
Okay, thank you very much, ma'am. But before we proceed, may I ask what should I call you?
Dayan.
Okay, Ma'am Dayan, so the procedure that I'm going to do to you is the perineal flushing. It is to remove the normal perineal secretion as well as to prevent infections and contaminations in your genital area. So this means that I am going to touch your genital area. Is that alright with you?
Yes, nurse.
Okay, so do you have any questions or clarifications that do you want to address?
None.
Okay, so I will just lock the door. So before we start, ensure to screen the patients or lock the door before doing this procedure in order to provide patient's privacy. So now, cover the patient's body and legs up to the corner of her head, up to the corner of her feet, and the other side of the patient's body. So after that, position the patient in a dorsal recumbent with her knees flexed. Okay, Ma'am Dayan, I need your knees to be flexed. And put the bedpan in the bed. But before that, place a draw sheet first. This is used to prevent the bed becoming soil. So now drape the patient, exposing only the genital areas. So draping the patient means the minimum exposure, the lesser the embarrassment, and of course to provide warmth. So since we are not allowed to expose a real genitalia of a woman, this printed genitalia here will be my alternative. So now let's inspect the perineum and flush the perineal area with warm water. So note for any inflammation, swelling, excessive perineal secretion, and the presence of odor. So this warm water is used to prevent chilling and dissolve the blood clots. So now get a cotton ball soaked in a cleansing solution together with the forceps and kidney basin. So of course, Remember to donning of sterile gloves is very important during this procedure. So the first step is to clean the external genitalia starting with the midline of symphysis pubis down to the anus. Remember to never restroke the cotton balls to prevent contaminating the area. So the second step is to clean starting from mons pubis in figure 7 by way of external labrum towards the anus. For secretion tend to collect around the labia minora, facilitates bacterial growth. So then discard and do it on the opposite side with the next cotton ball. So with the fourth cotton ball, cleans the starting from mons pubis in figure 7 of by way of external labrum towards the anus. Then discard and do it on the opposite side of the genital area. So with another cotton ball, cleans the groin starting from groin going up to the thigh. So here's our thigh. Then discard and do it on the opposite side. Here's our thigh. So then, after that, flush the perineum area with warm, sterile water. So now, using the 7 dry cotton balls, dries the perineum with the same stroke as we did earlier. Drying the perineum is very necessary because moisture supports the growth of many microorganisms. So now, let's remove the bedpan gently. And turns the patient to the other side. So since we have only the printed genitalia, we cannot turn the patient to the other side. But in a real setting, we need to turn the patient in the other side because if it seems necessary, take one ball and clean one side of the buttocks as well as the other side. Then dries them both. So we have our buttocks here. Turns the patient on her back and make the patients comfortable. Then use the antiseptic spray to promote healing. Then I am going to place a perineal pad with an upside down motion. So, Ma'am Dayan, we're done doing the perineal care and I'm going to discard the soiled materials. So, how are you feeling now, Ma'am Dayan?
I feel refreshed and clean. Thank you, nurse.
You're welcome. So, do you have any questions or clarifications that do you want to address?
None.
Okay, so I'll leave you now so that you can have your proper rest. Okay, so do not forget to do an aftercare of the materials to promote clean environment and document the records of the treatment and observe the discharges. So do not also forget to perform hand washing procedure. So for the documentation processes or purposes, the procedure was done means its communication and any unusual discharge is only the localized area of tenderness.